Millions of women worldwide are used to having me be a part of their daily regimen. If they miss taking me, anxiety is sure to follow. I come in many shapes and forms, but most commonly I am contained in a package labeled by the days of the week. What am I exactly? Female contraceptives. According to recent studies about birth control, instead of causing anxiety, it has been found to actually cause depression. In this video, I will be explaining why birth control being linked to depression is a topic of interest, the current state of knowledge, any controversies, and where things are leading to after this discovery. First, I'll begin with the definition of depression, as well as explain why birth control being linked to depression is a topic of interest. Depression, as defined by the Mayo Clinic, is a mood disorder that causes a persistent feeling of sadness and loss of interest. Taking out the variable of birth control, women are already twice as susceptible to acquiring depression compared to their male counterparts. I believe that this is a topic of interest for the fact of how little we actually know about the causes of mental health issues, such as depression and anxiety, and how this correlates to medications such as hormonal contraceptives. Our current state of knowledge comes from the study that was recently done by the scientists at the University of Copenhagen. Their research, that was published by JAMA Psychiatry, was the first ever to draw this connection between birth control and depression in women. In their study, they found that women between the ages of 15 and 19 who took oral contraceptives were 80% more likely to end up depressed. The Washington Post's Katie Mettler adds on to the statistics, saying women who used the combined birth control pill, a mix of estrogen and progestin, were 23% more likely to be prescribed antidepressants than non-users, and progestin only raised the likelihood by 34%. With the patch, antidepressant use doubled, risks increased by 60% for vaginal rings, and 40% for hormonal intrauterine devices, also known as IUDs. Aside from the statistical evidence, many controversies about birth control being linked to depression has risen from this study. For example, many experts are saying the sample size of 1 million women had too much diversity in the sense of the developmental stages being represented. A journal entitled Pediatrics adds on to the controversy, suggesting that the mood disorder could be solely caused by early puberty or is triggered by an immune response. As far as how things are going after the study concluded, the general population understands the effects of contraceptives on mental health. More importantly, people with occupations in the medical field now have statistical evidence to help guide women that are more susceptible to depression to either taking hormonal birth control along with antidepressants or finding an alternative route. In the future, I hope that scientists from the University of Copenhagen or other legitimate researchers will take into consideration the controversies and prove if they are valid or invalid.